right, we're live.
I have two computers open and I have two different times on my computer. Does somebody know the correct time?
I have 8:27.
Okay. That's what this one
8:27.
says.
I have 8:27 as well.
Well, I have 8:29. I'm going to check my phone, too. 8:27. Why, I oughta...
That power outage last Friday, it messed everything up.
My computer says 8:32, so what do we do?
Let's average it all out.
Average it out.
Synchronize our watches now.
Okay.
Okay, well, I have a computer that says it's time, so
Go for
looks
it.
like we're all here. I will call the Public Health and Human Services Board to order on Tuesday, May 18th. I will read the statement. Sorry, I've got to get that up here. It has been determined that an in-person meeting is not practical or prudent because of the COVID-19 pandemic and the related peacetime emergency declaration made by Governor Walz in accordance with Minnesota Statutes Chapter 12. We have ensured that all members of the body participating in the meeting, wherever their physical location, can hear one another and can hear all discussion and testimony offered at today's meeting. We have also ensured that members of the public present at the regular meeting location of the body can hear all discussion, testimony, and all votes of the members of the body. We have urged the public not to attend this meeting in person because of the COVID-19 pandemic and have ensured that members of the public can view and monitor the meeting remotely in real time by broadcasting the meeting on the Cook County website. All votes will be conducted by roll call, so each member's vote on each issue will be identified and recorded. So we have the agenda. Does anybody have any additions or changes to the agenda? Okay, if not, we will move on to the approval of the consent agenda.
Madam Chair, this is Commissioner Mills. I'll move to approve the consent agenda.
Do we have a second?
And Swallowson seconds.
And now we will do the roll call vote. Commissioner Mills,
Aye.
Commissioner Swallowson,
Aye.
Commissioner Storley.
Hi. You're fading.
I am? Oh, okay. Commissioner Sullivan,
Aye.
Mr. Linehan,
Aye.
and Ms. Orist is somewhere on my screen.
Aye.
There you are, thanks. And Commissioner Hawkins is also aye, is approved. And so now we have a staff report from Ms. Erickson. I will turn it over. Unless Director McIntyre, do you have something to say first?
I just want to thank Lori in advance of the presentation and the entire PHHS supervisor team for the work that they put into preparing the report for today. As you likely saw in the agenda materials, it was a unprecedented year in all respects for our department and for our world, and that's reflected in our department budget this year. We had a significant underspending in several program areas due to changes in how services were delivered. and influx of revenue in the public health area that we did not anticipate. So I just want to give you that preview and again, recognize Lori and the supervisor team for the work that they put into preparing this information and really the story behind the numbers to give a fuller picture of what 2020 financials look like for the PHHS department. Take it away, Lori.
Thanks, Allison. Thank you, Madam Chair, and the rest of the board for your time today. I'm going to share my screen and I'm going to pause a couple times during the presentation. I know that you can't all see each other or see if hands are raised during the presentation, so I'll try to be aware of that and take some pausing here. So with that, so as Allison stated, the pandemic did produce many obstacles and opportunities in 2020. The way that we provide services to our clients changed a lot throughout the year. Between regular guidance updates from health officials and rapidly changing federal service delivery mandates, our staff were challenged often to creatively meet with clients in a manner that would keep everyone safe. The full financial report is attached to today's agenda and available online. So my presentation will review the costs and revenue and then highlight some of the work that was done in each program area of our 3 departments. And again, I will pause after each department for questions. Move my little faces here. There we go. In the 3 departments that make up PHHS, we saw a 15% decrease in budgeted expenses and an 8% increase in planned revenue. This combination resulted in an excess of revenue over costs of almost $1,025,000, which will be returned to the PHHS fund balance. Several factors led to our agency spending less than the budget and receiving more revenue than planned. In some areas, personnel costs were lower than budget due to less staff training and traveling costs and vacancies not being filled immediately. In other areas, personnel costs were higher due to staff overtime, the addition of unbudgeted temporary staff, and new technology purchases. Several programming areas saw a significant decrease in service costs while still responding to an increase in client needs. Unanticipated revenue was received, which offsets some of the additional expenses. The increased revenue came from governmental aid and charges for services. We received unbudgeted funds from the Federal CARES Act, as well as additional state-funded COVID-19 response grants. We also increased our collections from client health insurance programs. This additional revenue is a direct result of our staff providing increased targeted case management for mental health clients and increased care coordination for seniors. Program expenses were lower in the income maintenance and social services areas, but higher in public health. 2 vacant positions were budgeted in 2020. One was filled midway through the year. The other was not filled until 21. Client-related travel costs were down, as well as staff training and travel. The largest under budget cost was for children's out-of-home placements and mental health placements. Those are the most challenging costs to anticipate. In-home support costs were also down as clients and contracted providers were trying to maintain their distance and stay healthy. Federal and state funding made up 37% of our revenue last year. Charges for service, which includes reimbursement from health insurance plans and miscellaneous revenue from non-governmental grants and donations, made up another 8% of our revenue. A very small amount of revenue comes from the county collected liquor, beer, and wine license fees. And the remaining 53% of our agency revenue came from county taxes. In contrast with 2019, in 2019, 31% of the revenue came from federal and state funding, and 55% of the revenue came from county tax.
I'm sorry, Lori, could you say that once more?
Sure. In 2019, 31% of the revenue that we brought in came from federal and state funding versus 2020, where 37% of our revenue came from federal and state. In 2019, 55% of our revenue came from county tax, where in 2020, 53% did. All of the PHHS expenses fall into one of three department areas: income maintenance, social services, or public health. As I drill down into each of these areas, you will also notice a line item in each department titled Administrative Allocation. The administrative allocation is for costs for services that benefit the entire agency, and they're split proportionally among the income maintenance, social services, and public health departments. This includes the admin personnel costs, office supplies and phones, fees we pay to the state of Minnesota for the merit system, the state computer support, and annual audit, as well as funds that we transfer to the county general fund for the courthouse office rent and the county MIS costs and labor. Administrative staff include the director, one executive admin assistant, one office support case aide, fiscal supervisor, a fiscal officer, and one accounting technician. These staff provide leadership to the entire agency and collaboration with local, regional, and state partners, contract management and community outreach, front office support, budgeting and fiscal management, grant management and reporting, paying the bills, pursuing collections, as well as client finance management through the Rep Payee program. Several admin staff also participated in the EOC pandemic response last year with operations and community services support, logistics and finance, and donations management. So starting with the income maintenance department, the 2020 costs were 5% less than budgeted, and revenue received was also 5% less than budgeted. Eligible expenses that were paid for with the Federal CARES Act funding increased departmental costs, but it was all offset by the increased revenue. So you'll see a CARES Act line there that has an asterisk by it. We had increased expenses in that area, but we also had the increased revenue that offset it. And at the bottom of the screen, you'll see what we used the CARES Act money for. By far, the biggest expense in each department is the personnel cost of administering state and federal programs. This includes staff wages, ongoing training costs, data management systems, and the administrative allocation. You'll see this here for income maintenance. 69% of income maintenance expenses are in the area of personnel. Since 2013, child support services have been provided through a contract with Carleton County. Income maintenance staff consist of one supervisor, 4 eligibility specialists, and 1 case aide. These staff provide eligibility determination and reviews for several state and federal programs, such as cash and food assistance, healthcare savings programs, and child care assistance. They also process emergency assistance applications for services such as indigent county burials or housing support. Last year, staff also participated in the EOC pandemic response with administrative support. Besides receiving and processing new applications for economic assistance services, the income maintenance staff also maintains several hundred cases for ongoing services which require regular reviews and updates. This shows the new applications received in 2020 in red, along with the average annual caseload in blue within each program area. The healthcare applications shown here do not include those that are applied for online through MNsure, as our staff do not process those applications. So you will see that the healthcare applications that were received, although it's only 67 applications of new applications that were received in 2020, they still maintain an average caseload of almost 600 applications on file that require regular reviews and updates. Economic assistance programs made up 12% of the department's costs. However, almost all of it is reimbursed from state and federal programs. Economic assistance includes county-funded support for burial assistance and also reimbursable support for other assistance. This chart shows the 2020 costs in red versus the reimbursements that we received in blue. We received 99% reimbursement of all the costs put out for cost-effective insurance support, 96% of the provider transportation costs, and 100% of healthcare access assistance costs. Recipients of medical assistance reimburse the program after their passing through the estate recovery process. For our collection efforts, PHHS is allowed to retain a portion of the funds recovered and the remainder is returned to the state for future recipients. Our agency also collects client overpayments for the cash, SNAP, and GA programs. In 2020, we collected a total of $31,384 on behalf of the state and returned $24,552 to DHS. Some of it was for 2019 collections also. And for our efforts, our agency was allowed to retain $6,832. Before I dive into social services, does anybody have any questions regarding the income maintenance area? Oh, Ms. Hawkins, you are on mute.
Sorry. So the average annual caseload one, I was still that out when you went by. So new applications in 2020 is, and the average annual is what time frame were we talking when we were talking that average?
I believe Allison Plummer's on the line if you'd like to respond to that one.
Yes, sure. Great question. So this reflects a calendar year, January 1 through December 31st of 2020.
Okay. But your average new applications are 585. I'm sorry, I'm having a hard time.
Yeah, so the 585 is our average caseload, basically looking month to month for the entire year. So sometimes month to month it may fluctuate, like maybe we're at 570 and then we're at 600. So this is just an average of month to month, our average caseload of cases that are active and that we are maintaining, where in the red, the new applications represents how many applications we received in that entire year time span and had to process.
Thank you.
And if I may, Commissioner Hawkins would just like to add, and Allison as well, correct me if I'm wrong, but I think an important distinction about 2020 is the federal and state waivers that were put into place to maintain eligibility over the course of the year during the public health emergency meant that we didn't have as much churn across all healthcare and economic assistance programs, meaning people weren't losing eligibility and having to reapply at the same rate that they would in previous years. So this, again, without seeing the 2019, 2018 and historical data, I think this number is pretty low because of that factor of the state mandating that we maintain eligibility for households throughout all of 2020. And I think another distinction I'd like to make is that with the caseload, that these are households, these aren't individuals. So for example, a family, this 585 could include a family unit in which the children and parents are all eligible.
Correct. And that would apply to any of the other caseload figures for cash and food support, that it represents a unit. And that could be a household unit, a family unit. So usually you see more than one individual on a caseload. And yes, thank you for that clarification, Allison. With all of the waivers that were in place that did affect kind of ongoing eligibility for some of the programming, especially when it comes to healthcare, that there was very little turnover in terms of eligibility for those that were already recipients of medical assistance, that basically no one was closed. So really the the only new applications that we would really see would be for people who were not previously active on healthcare. So most people retained eligibility for the entirety of 2020. Cash and food support was a little different. People could potentially be closed and reapply. But as you can see, we definitely saw a substantial amount of food support applications compared to our normal average caseload.
Thank you. That really helps me understand this better. I appreciate it.
Yeah, great questions. Thank you for asking them.
Thank you, Madam Chair. Are there any other questions before I move on to social services? Awesome, thank you. Social Services Department expenses were 24% under budget, and revenue received was 5% more than anticipated. The new SUD treatment coordinator was budgeted to be hired in 2020. However, the position was temporarily filled by an existing staff working out of class for the entire year, resulting in lower personnel costs. Children and Family Services, including out-of-home placements, only spend 18% of its budget. Staff performing targeted case management and care coordination services generated more than anticipated revenue. This is reflected in the personnel area and the mental health services area in the revenue side. Eligible expenses that were paid for with the Federal CARES Act funding increased department costs, but again, this was all offset by the increased revenue. And you'll see the CARES Act line does have the asterisk there that shows the costs of over $19,000, but then we also received that $19,503 in revenue. And at the bottom of the screen, that shows what we spent the CARES Act dollars on. Again, the largest department expense is personnel costs for program administration. This includes staff wages, ongoing training costs, data management systems, and client-related travel costs. Child care employment and training services, which has just a tiny 1% slice of the pie, is provided through an annual contract with AEOA. The entire cost of that contract is reimbursed from the state of Minnesota. All the rest of the programming services are provided in-house. There are 14 staff in social services, 2 supervisors who also provide direct support and case management, 10 staff providing social work, case management, or care coordination in specific programming areas, 1 community support provider, and 1 case aide. These staff provide services in protection investigations, welfare case management, and mental health case management for both adults and children. They also provide treatment coordination services, developmental disability services, early response and intervention services for children and parents, childcare and foster care licensing, MinChoices assessments, and care coordination for waivered services and in-home support coordination. Additionally, several staff also participated in the EOC pandemic response with behavioral health support. Children and Family Services Unit spent 18% of its budget and collected 81% of the planned revenue. This area budgeted for 11 out-of-home placements for children needing shelter care, foster care, or residential treatment care. Cost for placement is based on the individual child's level of need and the daily rate of the facility or the foster care setting. The potential needs of the community are difficult to predict and to budget. Just to give you a heads up, for 2021, the budget was reduced to accommodate placements for 10 children. Substance use disorder services are supported by a combination of county funds, state and federal aid, and 1/2 of the county collected liquor license fees. Also, individual self-pay from clients and their health insurance. The charges in this program area include detox transportation and facility fees, electronic data management and billing systems, the county portion of the state's behavioral health fund, This is a fund that was set up by the state of Minnesota to help eligible clients with their SUD treatment costs when they do not have insurance. This used to be called the Consolidated Chemical Dependency Treatment Fund, or CCDTF. It's now changed to the Behavioral Health Fund. PHHS contracts with Wilderness Outpatient to provide individual or group outpatient treatment and aftercare services, as well as the Rule 25 assessments for level of need determination. In 2020, the number of clients receiving assessments increased, but the number of clients receiving outpatient services decreased, mostly due to the inability to hold group meetings safely. Our staff also provided treatment coordination services for clients who were seeking assessments and outpatient treatment, residential treatment out of the county, and teen intervention. In mental health services, we have one adult case manager, one children's case manager, and one community support provider. The number of staff hours logged in this area has increased 40% in the last 4 years. Over the same period, there's been a 50% increase in the number of clients in mental health work groups for both adult and children. Our agency has one social worker to provide developmental disability services for both adults and children. The number of active clients has remained constant in the last 4 years. Some children have aged into the adult category in recent years. When a client moves out of the county, the ability to transfer their case depends on what kind of services they have. There are currently 10 clients residing outside of Cook County who still receive services from our office. The number of staff hours providing support for adult and home and community-based services has increased 41% since 2017. Additionally, the in-home support program has seen an increase in the number of clients seeking support services to remain in their homes and in the community. Independent contractors are trained to provide eligible services and transportation for clients. The costs for these services are paid from a combination of client sliding fee, senior waiver programs, insurance reimbursements, and county funds. Even though the number of recipients looks lower in 2020 and 21, this is because there are currently not enough service providers to meet the needs of those clients, and several people are currently on a waiting list for services. Are there any questions in the social services area?
Madam Chair?
Yes, go ahead, Commissioner Mills.
Thank you, Madam Chair. And thank you, Larry. You mentioned there was a decrease in the out-of-home placement to 10 with the budget. Could you remind us what we budgeted for this past year, for 2020?
The entire amount for 2020, that broke down. It's going to be everything on the right-hand side there where it starts with shelter care.
I'm sorry, just the number of out-of-home placements. You had mentioned
Yes, there were 13 that were projected for 2020 with a cost of $315,689 is what was projected. And so we lowered the projection into 2021 of potentially serving 10 clients in that area.
Thank you.
Thank you. If no other questions for social services area, I will move forward to public health.
I have just a comment and a question for Lori and Grace Bouchard as it relates to our out-of-home placement spending. Would it be fair to say, based on the number that we had projected for 2020, the number of placements that we facilitated and the spending across line items for out-of-home placement, that that generally speaking, there were less out-of-county residential placements for Cook County families, and those children who were in placement in 2020 received out-of-home care within the county in a family foster care placement?
Thanks for that question, Allison. I don't know the exact numbers off the top of my head, but you bring up a really important point about cost and cost of care. When a county licenses a foster home, such as Cook County, and a child enters a family foster care setting, the cost is significantly less than if they're placed out of county in a group home setting or in a foster home licensed by a private organization, such as Lutheran Social Services. Those programs charge a daily administrative fee for each child that's in placement. So if a family unit is placed in an out-of-home care, the fee is $35 a day generally. And so that would be $115 a day just in admin fees along with the foster care fee. So those are some of the important variables. And the more we can license local foster families that are appropriately skilled for the level of care needed by the child, the less the cost will be. Again, we never really know what's going to happen. We've had some surprises over the last few years, but that is an important variable to consider.
Thank you, Chris.
Thank you.
All right, I will move ahead to public health. In public health, costs were 13% over budget and revenue received was 44% more than anticipated. Personnel had an unbudgeted increase in overtime hours and the addition of temporary staff. This expense is reflected within the CARES Act line as this funding did offset those unanticipated costs. Additionally, we received extra federal CARES Act funding to support local nonprofits and childcare providers to improve the safety of their operations during the pandemic. The cost of those grants was an unbudgeted expense. However, the revenue received did offset the costs. So again, you see the CARES Act with the asterisks showing that there were an additional $228,000 of expenses, but we did receive that $228,000 in revenue. Other COVID-19 response grants were also received. This additional funding supported the additional staffing costs and pandemic-related expenses. Minnesota Department of Health has identified 6 areas of public health responsibility within the Local Public Health Act. This shows the number of hours that our public health staff recorded within each of these areas. Assuring the adequate local public health infrastructure, promoting healthy communities and healthy behavior, preventing the spread of communicable disease, protecting against environmental health hazards. Those hours, that's a service that's provided by Land Services Department within the county and also MDH. Preparing for and responding to emergencies, and then also assuring health services. Our public health department consists of 1 supervisor and 1 public health educator. The public health educator position was filled midway through 2020. These staff, in coordination with our contracted partners at Sawtooth Mountain Clinic and North Shore Health, provide administration of several public health programs. We've got a large list there: community and teen checkup, evidence-based home visiting, follow-along program, home care sliding fee, outreach services, the SHIP program, universal home visiting, WIC, and WIC peer breastfeeding. Those are contracted partnerships that we have with Sawtooth Mountain Clinic and North Shore Health. Our agency also provides the community health assessment and public health emergency preparedness. 4 temporary public health educators were brought on in early August. All 6 public health staff have provided EOC pandemic support in areas of leadership, vaccine planning and implementation, case investigation and contact tracing, perinatal peer support, and liaison to the schools and businesses. The public health community funds are granted to community agencies through a competitive grant-making process. PHHS facilitates a subcommittee of the Public Health Advisory Committee, which makes funding recommendations each year to the Human Services Board. Grants are made in line with the goals that are set forth in the Community Health Improvement Plan. These represent areas of essential community service that would go unfulfilled without support from this grant-making fund. If it were not for county support of these community agencies, it could very well fall to PHHS to meet some of these unmet community needs. And what you see here are the public health community grants that are county funded that were given to the various agencies within Cook County. Any questions regarding public health? I feel you hear from Grace all the time.
Yeah, I have a question on one of the slides that said infrastructure. When I think infrastructure, I'm thinking roads and bridges right now. Can you explain to me what you mean by infrastructure?
Allison McIntyre, would you be able to explain public health infrastructure?
Well, you know, I told Grace Grenagger when she said she had a conflict this morning, and she's teaching at one of the schools, co-teaching a class, that I'm pretty confident I could manage any question in public health. But this is the level of detail in her time reporting, and I don't know that I can accurately answer your question, Commissioner
Okay.
Hoffman. I can take a stab that infrastructure is related to our statutory requirement to assure access to health for the community. So this would be similar to our community health improvement plan, ensuring that people have access to health services. Although I see that that's a separate area of public health responsibility, and other services and supports that promote public health and well-being in the community. But I can follow up with Grace and learn more specifically what types of activities fall under infrastructure. Again, my assumption is that it's access.
Thank you. I just, see a new word again, and I'm like, okay, that's not what I think of. So I just want to make sure I'm on the same page with you. Thank you very much.
We aren't building any roads and bridges. I can guarantee you that.
If no more questions, I'll move ahead. So as I stated in the beginning of the presentation, there was an excess of revenue collected over the actual costs for 2020 in all three areas. This totaled $1,024,995. This excess of revenue will be returned to the fund balance. Since county taxes are a major funding source of the three departments in PHHS, the Office of the State Auditor recommends that we maintain a minimum of 42% of our agency's budgeted expense in a designated funding account. This allows for the agency to pay its bills and staffing costs during the first 5 months of the year before property tax collections are processed and distributed. It also allows us to fund programming expenses that are later reimbursed by the state when quarterly reports are filed. So in this graph, you'll see a bunch of green bars. That represents the annual PHHS budgets since 2010. The red bars represent the 42% minimum recommendation that we should have been holding in our fund reserves each year. So looking at those red bars, in this graph, the red bar again represents the 42% that should have been in reserve to cover our expenses. But now you see the actual fund balance during those years represented by the blue bars. This fund balance dropped significantly below the recommended amount in several years. I learned this was due to unbudgeted expenses that occurred after the budget was adopted, such as hiring additional staff after the first of the year, or new mandated services that came about after a budget had been adopted. Since 2018, our fund balance has been where it should be according to state recommendations and healthy enough to meet our obligations. However, with the unprecedented events of 2020, our spending was much less than anticipated and our revenue was much higher than anticipated, resulting in a large return of excess funds back to the fund balance. That's a lot to absorb. There's a lot of numbers, a lot of graphs. And with that, I will take any questions you may have.
Madam Chair? Madam
Yes,
Chair?
Commissioner Story, just go ahead.
Thank you. So Lori or Allison, with the American Rescue Fund that's coming into the county, that could be beneficial to some areas. So I'm sure you're going to be looking into that.
Yes, absolutely. From the reports that I've seen, the county is going to be allocated over $1 million. I'm not sure when the first half of that would be arriving to us, but the second half is not slated to come in, I believe, until 2022. So it sounds like it's going to be a long process. There's going to be a lot of parties involved in seeing how this is going to be well spent in our community.
Mm-hmm. Right. And it has to be spent by the end of 24. So you'll have some time to get your bucket list ready. Thank you.
Anybody else have any comments or questions? Go ahead, Commissioner Mills.
Thank you, Madam Chair. Thank you again, Lori, for excellent presentation and in answering our questions. And I feel like we're in a good place with the fund balance, and that's saying a lot from the struggles that had happened in the past. And I'd go as far to say that we're in such a good place that that we might want to look at that. But I feel like we're going to be feeling repercussions in our community from just hardships from the pandemic, particularly mental health is what I would guess. And I think we've been seeing more of that trend too. And so I just wanted to throw that out there to the board that it looks really good and we are in a good place, but we're not free and clear yet. So I just hope that we can, take a cautious approach to our budget and our reserves and just be prepared for whatever needs our community will be facing in the future here. And who knows, maybe there'll be more federal funding beyond or more relief in other ways. But I just feel like that the department's had a hard enough time that we don't want to overextend ourselves, and we really want to strengthen the support that we can give. But without a crystal ball, we're just not going to know anything. So, but I thank you for all the work and the excellent reporting. It really puts us in a good spot. Thank you.
Thank you.
Yes, thank you, Lori. I really do appreciate that PowerPoint you did. It really helps me understand and understand what happens in each of those areas. I've been trying to make my own list of trying to sort things out, but what you did is so very, very helpful. So thank you for that. I know that took a lot of work for you to do that, but it is very much appreciated by me. Anybody else have any questions or comments they would like to make?
Thank you, Madam Chair and Board, for your feedback on the presentation. It's hard to explain to the public what we do. People can see tangible roads and bridges, and they can see the highway department driving down the road and understand that there was an expense for a dump truck. It's hard to explain that the biggest expense that we have is our biggest resource, which is our people that are providing the services. So I appreciate your support and understanding for the work that we do.
Okay, if nobody else has any comments, we will move on in our agenda here to our director's report.
Thank you, Madam Chair. Thank you, commissioners and board members for your thoughtful questions and comments. And thank you again to Lori and the full supervisor team for your assistance in putting the report together and being available to address questions. So thank you very much. With that, I thought I'd start with giving an update on where we are with addressing behavioral health service gaps as a department. Last month, I presented a scenario for expanding behavioral health services within the PHHS department in response to staffing changes and the availability of therapeutic skills services from Ascend Services in Cook County. Since we last met, we've learned that Ascend has lost another local Cook County provider. So where we are at present as a department is that we are beginning by integrating therapeutic skills services within existing positions in our department. As I shared last month, in absence of qualified providers in the community, the provision of skills services oftentimes falls to our case management staff in both the children's mental health and adult mental health area. By adding these responsibilities to existing staff positions, we are formalizing this, recognizing that in absence of resources to refer out to, that our staff are taking this on. And this, again, in conjunction with pursuing certification to bill for these therapeutic skills services, allows our agency to be certified and again bill for the services we're providing. This provides greater redundancy by integrating the work within positions and allows us to be more responsive to emerging needs by scaling up or down across several positions. So where we are beginning with this process is in our recruiting for our current vacancy for substance use disorder case management. We have modified that position description to include more broadly co-occurring disorders, including adults with mental illness and substance use disorder, and have included in this position as well a therapeutic skills component. So again, we're actively recruiting for that position. It closes on May 21st of this week. In our consent agenda, you acknowledged the resignation of Matthew Baxley as our community support worker. With regrets, we have been so thankful for the services and skills that Matthew has brought to this new role over the last year. It was a new venture for us as a department, providing that level of service following the closure of the Human Development Center. And Matthew really allowed us to develop that service as a department, and we're so thankful for his service. Matthew, again, as you heard in our presentation from Lori, along with Grace Bouchard, was very instrumental in leading our behavioral health response as a department throughout the pandemic. So as we are recruiting for Matthew's replacement, again, we're modifying that position description slightly to incorporate additional therapeutic skills beyond the community support so that this position would be able to generate, and the agency would be able to bill for revenue associated with those services. We are also including a children's mental health case management component in that position to add more depth and redundancy, where currently we have just one children's mental health case manager in our department. Meanwhile, we are continuing to pursue certification for daytime crisis response. This process has been delayed due to staffing changes both at HDC and within PHHS, but we are still moving forward and again see this as an opportunity to really formalize and integrate services that again fall to our agency in absence of a qualified local provider. We have reviewed these proposals, both the integrated model of behavioral health service expansion, as well as the reorganization of the Children and Family Services Unit into two separate teams, one providing child welfare case management services and the other team focusing on behavioral health services. We've presented both of those scenarios to our Public Health and Human Services Advisory Council and Local Mental Health Advisory Council, and have received some really good feedback from the membership on both of those citizen groups. Some of this you saw summarized in the notes from PHHS Advisory Council Chair Roger Linehan, included in the agenda. Some of what we've heard from these groups include advocacy and support for really strengthening the resources internal to our department. So we are less vulnerable to the changes in our community, is less vulnerable to the changes that are outside of our control. When there are significant changes in service delivery locally. We have also been encouraged to move towards a goal of having even that clinical supervision component provided in-house. And we have the ability to build on that with some staffing currently and degrees and certifications that our team members are in the process of pursuing. So at this point, just wanted to provide the update to you that we are not pursuing any additional FTE for the 2021 budget year. And we anticipate, however, that as we integrate the services within existing positions, that will be better positioned to evaluate the level of need and propose any additional FTE if needed in the behavioral health service area for our 2022 department budget. With that, I'll take a pause if there are any questions about where we are with behavioral health service gaps and staffing.
Madam Chair. Thank you, Madam Chair. Thank you, Allison, for the update. And I guess my concern, and of course I'm trusting your judgment and the department's judgment, but my concern is just that whereas integrating this, I think is an excellent move. My concern is just that it may not fill the gaps that are opening very quickly here. But I think I think it is a very responsible step towards, as you say, evaluating what those needs are. And so I think it's certainly working in the right direction, or I like the direction that it's working in supporting our community. But of course, my fear is that it may not quite be enough with the level of vacancies in our community. So I understand we need to walk the line a little bit there and be responsive and also responsible. So thank you for your work in evaluating that and walking that difficult line. So I'm very supportive and think this is a good path forward. Thank you.
Thank you, Commissioner Mills, for your comments, and I will continue to keep the Public Health and Human Services Board up to date each month as we move forward with this integrated model and continue to assess needs as they emerge. My last staffing update is that we are also determining how to best move forward with public health staffing capacity. As you heard in Lori's presentation, we brought on a number of temporary staff last year with the Supported CARES Act funds. Both the contracts and the funding for these temporary positions expire this summer. And we are in the process internally of developing scenarios for how we can best ensure that we're able to continue to provide the essential functions of case investigation and contact tracing, school and business support, and education and outreach as the pandemic continues to impact residents and the community as a whole. Just briefly, I have a few agency updates to share. We are recognizing and promoting Mental Health Awareness Month in Cook County throughout the month of May. later this month, or later this week, rather, tomorrow, in fact, we have a speaker event that we are partnering with Cook County Higher Ed and a number of local service providers and healthcare providers. And I want to thank Grace Bouchard for your leadership in bringing that speaker event here. Really looking forward to that tomorrow. I also want to give the board a heads up that a survey is forthcoming from the PHHS department with the internship project that we are working on with Sarah McLeod, who you met last month. She is a Master of Social Work student who's working with our department to better understand transportation gaps in Cook County and how we might address those. So we will be issuing a media release likely later this week to publicize and promote that survey. Lastly, we'll just say that we're doing a lot of work around planning for staffing and operations in preparation for the courthouse reopening to the public on June 1st. It's another big transition for our staff, our department, the people we serve, as we are anticipating more walk-in traffic to the department. So excited about that, but having to do a lot of planning to ensure that we have the right volume of staff on site and are able to meet people's needs safely for those increased face-to-face visits in our offices. Those are all the updates I have for the board this morning. Happy to take any additional questions.
Thank you, Director McIntyre, for that. Do any of the commissioners or anybody have any questions or comments? Okay, Commissioner Mills.
Thank you, Madam Chair, and thank you again, Allison. I guess this is a question for Grace Bouchard, possibly. Do you think the higher ed presentation will be appropriate for children? But yeah.
I don't know. I observed. I participated in one presentation. I think it would be fine for people to hear about the struggles. It might be upsetting for some children if that was an event that went on in their home. But ultimately, the message from the presentation is one of hope and resolution through communicating freely. I guess that's interesting that you bring that up, because that was one of my questions for the Q&A that we're doing, is just to find out how do you help children feel confident that their parent will be okay. And so I think if a parent is watching it with their children, I think it'll be just fine.
Thank you.
Mm-hmm.
Administrator Yorkie, you had your hand up.
There we go. Thank you, Madam Chair. I just wanted to say, you know, Allison was talking about not building roads and bridges. And I think that's one of the things that makes PHHS really challenging is for departments like Highway or our maintenance department, they've got a finite set of buildings or roads and bridges that they have to tend to. And the work is fairly predictable year to year. We know what we're dealing with. PHHS is so much more dynamic than that. And that makes it a really challenging job to try to figure out how to apply resources in the best way, especially when we rely on community partners to help provide services that the community needs. And it's just such a dynamic world. And listening to Lori's presentation this morning, and by the way, Lori, you did a great job, just really drove home the point of how complex this environment is. And it requires a lot of flexibility, a lot of adaptation. It requires being really responsive to what's going on in the community. And that's a really hard thing to do. So I just want to say my hat's off to staff for the great work that they're doing to try to stay on top of the community's needs and to try to make adjustments as needed to make sure that the community is well served. I really, really appreciate your work. Thank you.
Commissioner Mills.
Thank you, Madam Chair. And Administrator Yorkie's comments spurred just the idea that there are no literal roads and bridges, but many, many figurative roads and bridges, right? The pathways to services, the bridges to connect people in our community, that both that are in need and who want to help. So that's probably not the infrastructure part of that slide, but I really liked that that metaphor.
Yes, I agree, Administrator Yorkie. I really appreciate seeing the list, because I think a lot of our people in our community don't really understand all of the services that are provided by Public Health and Human Service Department here. And so I think it's very helpful to have such a detailed presentation that lists things out, and we know we don't see everything every day, but it's nice to know that we have people working on these things that are very important to our community. So thank you so much for that. Any other comments or questions? No? Okay, we will, let's see, we're on items for board action. We have the revisions to our emergency assistance policies that we discussed previously. And I hope you've all had a chance to look over those changes that were made. Any discussion? Questions? If not, okay, Commissioner Mills.
Thank you, Madam Chair. I just want to give a thanks for those revisions and the willingness to of course reevaluate them again as we see how this works and if we need to make further changes. So really appreciate the work done there, and looking forward to revisiting again.
Thank you, Commissioner Mills.
And Madam Chair, I'd make a motion to approve the revisions.
Thank you, Commissioner Mills. Do we have a second?
Surely support.
Thank you. Any discussion? Okay, I will call the roll. Commissioner Mills.
Aye.
Commissioner Storley.
Aye.
Commissioner Sullivan.
Aye.
Commissioner Swallison.
Aye.
Zavrist.
Aye.
Mr. Linehan.
Aye.
Commissioner Hawkins is also aye. That passes unanimously. And we will move on to our committee reports. Commissioner Swallison.
Yes, thank you, Madam Chair. The Active Living Steering Committee met on May 4th. We planned out and got support for some in-school bike education updates. The one at Great Expectation School was scheduled for last week, May 12th through the 14th. And for ISD 166, that will be May 19th through the 21st. Also, just of note there, next week we will have an update and I believe our final discussion on the projects for the Safe Routes to School project, and that will be on May 25th. And if I've forgotten something, Andrea will help me.
Oh, I think that's pretty good.
Thank you. Commissioner Mills.
Thank you, Madam Chair. AOA canceled the meeting, but I did have a small group discussion with Scott Zahorik, the director, and Dave Johnson, who's in charge of the housing rehab and weatherization, and Shane Steele, who is the City of Grand Marais sustainability coordinator, had a request from Shane for a connection and meeting, just to try to get updates or a little more progress report on the programs in Cook County and specifically Grand Marais for their interests there. And so that was a really good connection. But beyond that, I don't think I have anything to report at this time. Just as a small detail, there's a fair amount of discussion about heat pumps and how that can play a role in helping families pay the bills, and there's a fair amount of interest in getting some kind of a pilot going, even if it's just one example in Cook County on the viability of that technology. And number of challenges there, one of which is just getting the heat pump. I guess supply is an issue. And then also, which is a common issue for us up at the end of the road, is having a qualified installer. And so one of the opportunities lately for, I guess I don't know if it was through the Cook County Local Energy Project or what organization, if it was higher ed, but there was certification for solar installers, and I guess so there's 5 more solar installers that are certified in Cook County, which I thought was pretty amazing and significant. And so there's a possibility that we could get that a similar type of program for the heat pumps, if that is in fact as wonderful as they say. So.
Thank you. Let's see, you're next for the Arrowhead Health Alliance also. Do you have anything to report?
True story. No, I do not have anything to report this month. Thank you.
Thank you. Arrowhead Regional Corrections. We had our meeting, last Zoom meeting, and we were discussing the meat processing plant that is being proposed. And then I got an email the other day that maybe there's some issues with the legislature about that. So we have our meeting on Friday, and it will be our very first in-person meeting. We are all vaccinated, so I'm excited to meet these people in person. And so I will have more to report what we find out about our meat processing plant at NERC on Friday. Well, Commissioner Swallowson too will be attending that meeting. Commissioner Starley, Arrowhead Regional Development Council.
I don't really have anything to report. We're meeting tomorrow.
And we're back to Commissioner Mills, Community Health Board.
Yes, thank you, Madam Chair. Nothing to report from the CHB this month. I did just a brief rushed report, I think, last month, and I think I mentioned we just did the annual review for our new director, and so that was very good. She did a self-evaluation and some of the accomplishments and challenges, and I don't have anything specific beyond that.
And now we have the Ms. Orest. There you are.
Here I am. Thanks. So the public, nope, not the Public Health and Human Services Board. Sorry, Roger. The Mental Health Local Advisory Council met on May 11th, and we discussed May being Mental Health Awareness Month and received a similar information about the presenter for tomorrow. And we learned that Sawtooth Mountain Clinic is moving closer to being able to safely provide in-person behavioral health services, hopefully in the short term. And then we continued to work on our mission and vision process, but we are getting much closer on that. And that's all that I have to share.
Thank you. Let's see, the Restorative Justice Committee. Unfortunately, I, at the last minute, had a conflict and was not able to attend their meeting. They are doing some trainings for volunteers. So if you are interested in training to be on a volunteer for this committee, you are encouraged to reach out and take this training. Commissioner Sullivan.
Well, the Council of Aging has been not only having their monthly meetings, but we've been doing very regular and lengthy work sessions. I reported last month they had worked on establishing and reviewing their articles of incorporation, updating them. Their paperwork had not been reviewed since 2007, and there were a lot of Minnesota statutes that have changed during that time. So the new articles of incorporation or amended ones have been approved. And we've worked very hard on a new volunteer handbook for those individuals volunteering at first and second. And then the current effort is to examine all of the bylaws and bring them up to date according to statute and to their actual practice. So we have a work session coming up on Friday, and are just very excited with the effort that's been put forth to examine what they do and how to do it in the best way possible and the most efficient way possible.
Thank you. Do you know the hub, are there plans yet to reopen to the public in some capacity?
They have a meeting that was scheduled with Andrea. I can see Andrea smiling right now. Andrea, do you have an update from the meeting with their leadership?
That meeting is on Thursday this week at 1 o'clock.
But they are actively looking at and trying how to figure out how to balance people coming in, whether they're vaccinated or not, how they're going to handle masks, and then also looking at what's going to happen this summer as that area in particular gets very, very busy, and they have some walk-ins. So Andrea's going to have an important meeting with them, and I know good work will come forward from that.
Okay, thank you. Yeah, I know that there's members of our community that have missed having that social time that organization provides. So I'm looking forward to figuring out a way to get back to that. Commissioner Mills and, well, Commissioner Sullivan, emergency preparedness.
Thank you, Madam Chair. So little updates on, again, the fire danger, and that's kind of touch and go. Had some moisture, so that helps a lot, but you don't want too much moisture and for prescribed burns, but we haven't had too much, and now it just kind of teeters back and forth to where our danger is at. So a little bit of update there, also updates on vaccination, and the public outreach and messaging there. I think we also talked a little bit about the American Rescue Plan, and beyond that, I'm drawing a blank. Commissioner Sullivan, is there something beyond that?
Those were the primary things, I think, really looking at our vaccination and then the fire danger and just keeping the public informed about the prescribed burns that are occurring. There were a couple of last week, and actually today, one up by Baker Lake and another one up between the Arrowhead Trail and Grand Portage. That's pretty significant, 1,500 acres. So just making sure the community is aware, and anyway, we'll hope that that rain comes later this week. It looks like a few days we'll have that, and that will be greatly appreciated by many.
Yes, thank you. Okay, Healthcare Planning Committee, Commissioner Storley.
Yes, a few things to report from the area of getting together on health planning. Kimber reported that she has a retirement, and that's Amy James was retiring out. And Carolyn Olson is working with North Shore as an interim director of nursing right now. They will be needing a director, but she's willing to fill in. Jan Sorensen from Grand Portage reported that Grand Portage is 70% vaccinated. And they're going to have their wellness fair this summer, which will be June 19th. It'll be outdoors, and it'll be right at their community center. At Sawtooth Mountain Clinic, Kate reported that they're having a new pharmacist who moved from just being regular pharmacist, and now she's the pharmacist in charge at the clinic. Anna Krovashenko will now be working as their pharmacist in charge. Kay Grenlin reported that they're planning on some updating and training opportunities for their area of working with older adults and people in general in the community. And lastly, Valerie Orozco-Eliason reported that they have 2 new board members, Linda Jurek and Hillary Freeman have joined as board members, but they're lacking someone up the Gunflint Trail. So they would like to have a representation from the trail if people could be interested in joining that board, North Shore Care Foundation. And one of their big events for the summer is their barbecue. The annual barbecue event usually takes place in August, and they're hoping that they can still do it, but they will do it in a COVID way, meaning they will be spreading it out on the Gunflint Trail. So we'll hear more additional interest in that in the future. Thank you.
Thank you. And do you have anything to report from NACO?
Yes, the last meeting was a lot of talk across the country about the American Rescue Plan. And so that was one of the topics. The other event that's going to happen in July is their semi-annual meeting, which will take place. I will join them virtually with the health planning committee part of it, but I'm not going to join them as a whole. I normally would go to those events or pick whichever one I wanted to go to, either the summer one or the one in March in Washington, DC, but I will attend virtually just the healthcare planning. That'll be sometime in July. And that's my report.
Thank you. Commissioner Mills, job training program.
Thank you, Madam Chair. Firstly, I just wanted to thank Commissioner Storley for her work with NACO. You know, just like AMC really helps us navigate and leverage at the state level. Just having Cook County representation or involvement with NACO, I think, is wonderful. So thank you, Commissioner Storley, for whatever virtual or in person. That's much appreciated. For the Northeast Office of Job Training, NEMOJET, they're looking at some rebranding, but not too drastic changes. It was said we can't change our name legally, or that'll just cause a financial headache for all the reporting. But they're looking at rebranding and trying to get their image out there more. We talked a little bit about, again, director review. We have a new director there. And she had done a self-evaluation already, and so I was going to share that. And then I also asked just about if we want to do kind of a 360, getting feedback from department heads there, and I think that'll be happening in the future. Maybe not this go around, but then she was looking for feedback, and I mentioned that'd be really nice to get county-specific actions, just so we can report back to our respective counties about what's happening through the Northeast Office of Administrative Job Training, because a lot of times things are interwoven, and it'd be really nice to get some, clear, measurable results, right? And then I'm sorry, there was another item discussed. A lot of it's just roundtable with other commissioners. And so, everything from jail projects. It sounds like Carleton County is looking more at a justice center at this point than their jail project. So it sounds like that'll grow substantially, and they've gone all over the place with state involvement, and I think it's largely just getting pushed by the state. But this isn't really related to jobs. I'm just reporting on the conversation. So beyond that, I think that's all I have to report.
Thank you. And I appreciate you asking for more specific Cook County information. I think that's very helpful for all of us to understand more of what this group does. Thank you.
Yeah, and this group in particular, I feel like it certainly doesn't have a strong presence in Cook County as it does in, say, St. Louis County, where there's a much greater need for getting more jobs trainings. I think here we really need more people and more housing, and we hear that from other counties as well. But certainly the other counties really need that training, and are having a lot more struggles getting the skills to the people, and the people are there. So, but we still want, as we say, measurable results.
Yes, thank you. Okay. Oh, make sure I didn't skip one here. Oh, North Shore Collaborative.
Thank you, Madam Chair. Yes, a couple exciting things. We welcomed Rachel Lichty from the Cook County Early Childhood Coalition, as well as Nancy Deming from the Lake County Early Childhood Coalition, to our coordinating council members. And the coordinating council on that is really helping give perspective on the various organizations that we're oftentimes granting monies to. And so it's been recognized both in Cook and Lake County how important childcare is, and especially to support families and just to have a healthy community. We need to start in the early years there. So having their voices on that coordinating council, I think, will be excellent. And there's large programs. I believe Sawtooth Mountain Clinic is going to be the fiscal agent for that are developing, and I think it's just a pilot program, but it sounds substantial, and really look forward to what we find from that, or what they find from that, and we'll hear about it certainly. Also, we had a presenter on the ACEs training, and I know we've already had that in Cook County. I was not a part of it. It was still too new to me, at least, for me to participate, and now I know more about it. I am very interested in that training, and I would encourage any and all of us on the Public Health and Human Services Board to be a part of that, just to get more perspective, because that, again, goes to the importance of these early childhood years, and how the more we can do then, the better off we'll all be down the road. And just the impacts are so huge, both adverse experiences as well as positive ones. They can have just huge impacts. So looking forward to that. And I know we have staff who have gone through that, and it's a significant time commitment if you're going to complete the training and follow through. And I think that'd be important, but it involves giving presentations. So we can all polish up our presenting skills for that. We also talked about the LOTS program, distributing books to children in the areas, and just whether that should be in person or distant. And last summer it was distant, and had some good success with readings on YouTube. And there had been requests from some of the instructors to do in person, and as a board we were feeling pretty cautious about promoting that at that time. And now I think with all the lifting of mandates and just more guidance from CDC, I think if we were to revisit that, we'd be much more comfortable. But we did give the option to do it either in person or virtual. So just based on the educator's comfort level, and then of course the parents who bring the kids there. So it does give me a little, or it gave us all a little pause, I think, just knowing that the vaccinations of children wouldn't be here in time for the summer program, but there's a real need for kids to interact at the same time. So I think that's all I have to report there.
Thank you. Mr. Linehan.
Thank you, Madam Chair. I would just underline what Commissioner Mills just said about the importance of ACEs training. For anybody on the Public Health Board, it would be a good training to get. I think there are some that you can, and Allison or Grace or Martina can probably correct me here. I think there are some available that don't require you to teach in the future, but I would certainly support anybody that's wanting to do that. It opens your eyes up and it's a good education. I don't have anything to add to what I had from the PHHS Advisory Council. We're mainly focusing on the mental health services provided by the county and the Tobacco Coalition, both of which had good support from the PHHS Advisory Council. I would just throw in my thoughts a little bit, that we need to provide as much service as we can locally and not rely so heavily on outside agencies from beyond the community. I think anything we can do to support that is very important. I think any additional services we can bring in, either through the county or through agencies that are here locally, like the clinic or in Grand Portage, the better off we will be. Relying on people 150 miles away, it causes me concern. That's just one of the things we have from being up here at the end of the road. When, we have good things, we got things that are maybe not so good. But I think Allison and her group are doing a good job of planning, want to support that. And I think I'll just leave it at that.
Thank you. I agree. I think what we can do in our own community is beneficial. I worry right now that we all know the lack of housing and it's moving. It isn't just affecting the service industry, it's affecting everything. And so we have a dual problem here. We need services and we need places for people to live to provide those services. So that's something we all recognize, I think, that is a major issue in our county, and hopefully we can work together to come up with some good solutions. Okay, anybody else have anything else to add?
Can I just add something really quick?
Yes.
Just a reminder that tomorrow is the last AEOA food distribution from the coronavirus food, some CFAP program. I can't remember what it stands for now, but the one in Grand Portage starts at 10 at the community center, and the one in Grand Marais starts at 12:30. And then there's another one in Finland. I think it's either at 2 or 3, but that will be the last run through of that program.
Thank you for that reminder. And I would encourage you all to attend tomorrow's presentation through Higher Ed. If you have not already signed up there, I think Director McIntyre sent the link out to us in the chat. So I look forward to seeing that tomorrow night. And if there is nothing else, we made it before the committee of the whole, barely. Do we have a motion to adjourn?
Commissioner Mills will move. Pardon me.
Okay.
Sullivan seconds.
Thank you. Roll call. Commissioner Mills.
Aye.
Commissioner Sullivan.
Aye.
Commissioner Storley.
Aye.
Mr. Linehan.
Aye.
Commissioner Swallison.
Aye.
Ms. Orist.
Aye.
Commissioner Hawkins is aye. I think I got us all. Everybody moved around on my screen. So I think that it is unanimous and we will adjourn. Thank you very much.